Hi, my name is Dr. Malcolm Murray, and I'd like to welcome you to my dental office here in the city of Fairfax, Virginia. Right this way. We'll just walk right back into my office. It's actually a pseudo office. So we'll sit down, we'll talk, and kind of give you an idea about dentistry and what I do on a regular basis here in my practice. Right this way. So as I said, my name is Dr. Malcolm Murray, and I'm a general dentist here in the city of Fairfax, Virginia. I've been a dentist for a little over 20 years, and I love what I do. To be quite honest, I've actually been practicing dentistry, as I said, for over 20 years. I kind of knew dentistry was what I wanted to do probably in 6th grade. As a kid, I was really good with my hands. I like to break things up and then put them back together. There would be times where we'd go out and buy packages and boxes where instead of them actually being assembled, I'd have to read the instructions and put them together just by reading the instructions on my hand or with my hands. I got a big kick out of that because I was able to see the big picture in the beginning once the project was actually, even before the project started. So I could see the project in the beginning and then I could see it completed. As I said, I was a kid really from 6th grade wanting to be a dentist, and I just knew it, and partially because I was a kid that lived right across the street from the dollar or the penny candy store is what we called it. I was a kid who loved going to the store and buying candy and just eating it. So I had lots of cavities as a kid. I probably went to the dentist monthly, sometimes weekly. Almost every tooth I had a cavity or there was something going on in my mouth, and I would always watch the dentist and think, wow, I could do what he's doing. He's using his hands, he's working hard, and it really seems like he knows what he's doing, and I thought if he could do it, I probably could do it. So I went on to middle school, I went on to high school. Once I got through high school, I did 4 years of undergrad college where I went to Hampton University, right, and also in the state of Virginia. I left Hampton after 4 years and I went on to the Medical College of Virginia School of Dentistry, which is also in Virginia, but that happens to be in Richmond. There is where we really got into dentistry and where I really learned my craft. I was then able to see patients. I was then able to work on lab cases. I was then able to really hone in on what it was that I wanted to do as a dentist. I did the 4 years there at the Medical College of Virginia School of Dentistry, and then I did a 1-year advanced education in general dentistry, also in Richmond at the hospital. Great experience. We got to work on medically compromised patients, and we also got to work on patients that were afraid to go to the dentist. They had issues that they just really didn't want to go in the public and be seen, so they would come to the hospital and we'd work on them there. I actually opened this practice here, as I said. I've been a dentist for a little over 20 years, but I opened up this practice 16 years ago. I am a sole provider, and what I pretty much do is I run my practice. I have a staff of over 6 employees. It takes a front desk employee, so we have 2 individuals at the front. I have 2 dental assistants, and I also have 2 hygienists. It's a busy day, it's a busy schedule, but we have a lot of fun. Sometimes we like to think of let's have fun and then let's do dentistry. And it works well. Our patients, they come, some of the patients actually have a lot of fears of coming to the dentist, and so my team, they do a great job of consoling patients and making sure the patient's appointment will be comfortable. My team also, especially in the back, they're also good with their hands because it doesn't take just one good practitioner. You actually need a good team and a good staff to know what they're doing and know how to treat patients. In dentistry, there's probably a little over 5 or 6 specialties that we'll talk about. Obviously, there's a general dentist, which is what I am. There's an endodontist, which is one who does root canals. You guys have probably heard of root canals needing to be done, where pretty much if you have a cavity on a tooth that you haven't had treated in a while and that cavity expands and it gets so far that it actually reaches the nerve. Once it reaches the nerve, you have to do a root canal where pretty much you leave the tooth intact but the nerve, which is in the center of the tooth, is now removed. Kind of a gory thing at some point, but it definitely takes you out of pain. It relieves the pressure in the tooth, and you still actually get the opportunity to have the tooth. There are oral surgeons, and oral surgeons pretty much do a lot of tooth extractions, and particularly wisdom teeth. So you'll have a lot of dentists who go on to be oral surgeons because they like pulling teeth. You have a periodontist, and a periodontist is one who does gum treatment and pretty much works with the bones and the roots of teeth. So you'll have patients that have gingivitis or a lot of plaque and calculus on their teeth, and they really need that stuff cleaned up. So typically you'll find them being seen by a periodontist. You also have a pedodontist, which is actually a child dentist. So all the things that general dentists do, a pediatric dentist would do, with the exception that they're working on kids. Pediatrics is pretty cool. You're working with kids most of the time, so beyond trying to do the dentistry on them, you got to really try and win a kid's confidence to get them over their fears, just so that you can find out what's going on and get them clean and also help with their teeth. Orthodontists, which a lot of kids know about. Orthodontists, they do braces. So if you have crooked teeth, or you have a misaligned bite, or you have some teeth that you just really don't like the position that they're in, you'd see an orthodontist. And that's pretty much what we kind of cover as far as the specialties of dentistry. As I said, I am a general dentist, and I love and I enjoy what I do. You take a patient who comes in and they have pain. I love the idea of being able to take a patient out of pain. It's my hands that are actually doing the work, and I think that's really what makes the difference. Being a dentist, which obviously I'm a doctor, a lot of times if you go see a physician, you're being treated with medicine, sometimes sutures, but in dentistry, I have to use my hands, and I think that's the big thing that kind of allows me to feel better and actually feel good about what I do, because I'm actually hands-on. Most rewarding for me is when I have a patient that comes in and they haven't been to a dentist in a while, and they have lots of issues, and from my front desk being able to comfort that patient, to my assistants being able to relax the patient, getting the patient calm, to my hygienist being able to educate the patient on how to better serve their teeth, and then to myself coming in actually summarizing all the things that have occurred and also getting that patient out of any pain, and they're walking out with a smile. That's the greatest attribute, that I walk out and knowing that I actually did something good on a patient. It's interesting, sometimes in dentistry I actually think of myself as a video gamer. We try and do a lot of things on the cutting edge forms of dentistry. We try to make sure that we do a lot of continuing education courses, just to make sure that patients know and understand that we are trying to do our very best out there to know what's going on, to know how to better serve a patient, and also to give them less pain. It's always good when you can go to the dentist and have less pain. What I want to show you today is just some of my Nintendo, PlayStation, Sega Genesis, and all the games out there, but this is my form of my hands-on PlayStation. This here is actually called a CAT scan, and this is a CT scan of a patient's jaw. And this particular patient actually has a missing tooth, and they'd like to have an implant in this particular area. I can take an x-ray here that you see right behind me, and this will allow me to take the CAT scan, and it uploads directly to my computer, and I can actually manipulate this patient's mouth. And as you see here, I can see the entire aspect, the patient's jaw, the patient's teeth. You'll see certain areas of their entire mouth and their jawbone structure. But most importantly, what I'm able to do here is I'm able to look in here and see exactly where there's space within the bone that if I so choose to place an implant, which you see we've done here, we can actually place that implant here. I can manipulate it, as I said, in any different direction. I can even measure the height of the bone here to know exactly how long the implant should be, or the bone width should be. I can look at, as I said, width, length, and just making sure that we're putting the ideal implant into that patient's mouth and we're able to see exactly where we go, because obviously there's some structures within the bone that you want to make sure that you don't touch or you stay away from. So my PlayStation will allow me to do that, and this patient would come in and we'd pretty much put that implant right in this particular area of the patient, and we know exactly where to go, where to put the implant, and lo and behold, my hands did that. There's another toy we use, and this here is a patient who actually wants to go through orthodontics. And so one of the good things that I like about being a general dentist is that we're allowed to do pretty much all the gamuts of dentistry. We can do implants, we do orthodontics, we do cleanings, we do veneers, we do crowns, anything pretty much associated with the mouth. We have the certifications to do. And so here's another scenario of what we do in our practice here. And here's a patient, as I said, going through orthodontics, and I pretty much can manipulate this patient's mouth. I can look and see what their ailments are, what the problems are. And this particular patient here, he didn't like his smile. And so to the image here on the left, we see exactly what the patient looks like today. And then the image here on the right, we can actually see how orthodontics can really help bring this patient's jaw into that nice proper alignment where we've now lined up his midlines. We see here that he's got a bit of crowding. We can also look at just the lower arch or just the upper arch, and in particular here's his lower arch, and we're able to see exactly how the lower arch looks now and how the lower arch will complete. We can do the same on the upper. I can look here and I see he's got multiple issues of crowding here. He's got some indentations in the teeth, and we pretty much have taken him from stage to stage, and as you see, his teeth begin to move as we're going through and we're moving. So pretty much we've taken him from this pattern to that pattern. And these are things that we can pretty much show a patient exactly what they'll look like once they've completed their orthodontic treatment. Now this here is through an observation of using Invisalign, which will allow you to be able to wear clear trays where you don't even have to use brackets, whereby you can go through orthodontics, no one actually know what you're going through, and by the end you go from here to a completed process here. Here's a final thing that I'll show you. This one here is a CEREC. So we actually do crowns the very day of treatment. So you would come into the office, you'd be able to have your tooth prepped for a crown, and you would actually leave the office for a crown. In this particular image, I'm actually here showing you that here's the implant that we also placed, and then here's the crown that we're placing on top. In the same scenario, we can manipulate this patient's mouth, be able to see exactly what's going on. We can see and we can make sure that the image is flowing and that the crown allows this patient to bite and it is right intact. There's a lot of options that we have here where we can just play with the tooth to see exactly what it looks like here. Obviously that's the implant, that's the crown. We'll bring that back up. We can also look to see how it looks in the mouth, where we have both the patient's upper and the lower arch. So this was just a small idea of what we do here in my practice and what I do as a dentist. I'd like to welcome each and every one of you. If you ever have